What's the dream? What's the dream up here for your pharmacy?
Well, just to continue to grow our clinical programs. I mean, I think that's the big thing. I love doing the diabetes classes, and I want that to just continue to grow, and smoking cessation. I mean, like, the story I told you. I mean, I want to have a lot of stories like that. A lot of stories of people who whose A1C went
Right.
down 2 points because they went through my class. I like having those stories, and so I just any more program. We try to anything that comes our way, in terms of opportunity, we try to take it and see if we can run with it. And so, yeah.
So Deanne Mullins was also teaching, and she had a classroom set up, and I loved how her model was that she had boxes of food. So it's like,
Uh-huh.
cool, this is what you made for dinner. Now
little
let's
fake
learn
food.
how to, well, it wasn't fake food. It was just kind of, let's learn how to read the packaging.
Which one of these would you choose?
Well, it
Right.
was, let's learn to read the packaging and see how this
Uh-huh.
is going to affect me. And she had some inspiration, which really pushed her into that. And her process was paper, and then she moved to Pioneer and got it completely. So what does your classroom setting look like? Like, she had patients actually coming into her pharmacy, and she had a classroom and got out the boxes of food, like the zebra cakes. And I was like, that's not something a diabetic should eat. But
Yeah.
yeah, it was super interesting, like her take, and it's like, let's get your file out and let's show you how to track this and look at food and where it's going to put you. So what kind of
Right.
classroom setting do you have? How many patients would you say that you come in?
So we have an actual classroom
Right.
in our pharmacy, which we've used for a lot of different things. We used it. That was kind of our COVID vaccine central,
Mm-hmm.
and we use it for. We actually have early voting there, and some other things. But for diabetes,
Interesting.
yeah, I know. For diabetes class, we have TVs up on the wall, and so we
Okay.
can connect. So I have PowerPoint slides for the different modules, like healthy eating and physical activity and healthy coping, all
Mm-hmm.
those different behaviors to help manage your diabetes. And so, but I also try to use I've brought in some sample healthy snacks to let people try. I also have some sample nutritional labels. I've got the plastic food. I haven't really incorporated that yet. I haven't figured out a good way to do that. I had in my first class, I have a friend who teaches yoga, and she does some chair yoga for older people who
Oh,
Interesting.
fun.
can't get down on the floor and get back up. And so she came and did a chair yoga demonstration during the physical activity module. So I try to make it more interesting than just me getting up there and
Mm-hmm.
talking at them. Also have a whiteboard, and so I try to get the class involved, asking them questions and getting their feedback, and then involving students as well. I love
Mm-hmm.
having pharmacy students and help me present, help me. I had one that made a Jeopardy game for the final class to kind of ask
Oh
them
yeah,
questions.
gamifying
And
things makes the learning more fun.